I'm good. My name is Emily. I'll be taking care of you today. Let me just clean my hands really quick. Can you just tell me your name and date of birth?
Morgan, July 26,
I'm going to
1990.
see your wristband. All right, great. Do you know who the president today is?
Trump,
Do you know what date it is?
December 10th, Monday.
All right. Do you know where you are?
My room in Georgia Court University.
All right, awesome. So today I'm just going to be doing a full head-to-toe assessment on you, so just checking everything, vitals, all that stuff, and basically just starting an assessment. So I'm going to start with just checking your posture, which looks great. Your skin color is good. You look basically pretty normal right now. Do you have to go to the bathroom or anything?
No, I'm good.
All right, the bed's in nice low positioning, so it won't hurt my back. I'm just going to start the assessment with your vitals, so I'm going to do your pulse and respirations right now. Let me just get my watch out. And alright, so that looks good. Pulse was 72, and your respirations were 16. Alright, so next I'm going to do your blood pressure.
Okay.
So if you want to just hold out your right arm for me. Okay. I don't need that yet, actually. Okay. Alright, and your blood pressure was 125 over 80, so that's also fine. Alright, so next I would take the patient's temperature and their pulse oximetry, but we don't have those tools here in the dorm rooms, so we're just going to kind of glide over that because I'm sure that they're normal. So now we're going to test your stereogenesis, so if you could just close your eyes for me and hold out your hand. And can you just identify this object for me?
No pen.
Okay, good job. And will you just hold out your hand again? This is graphesthesia now. And will you just tell me what I write in your hand?
A.
Yes, good job. And on a pain scale from 0 to 10, how would you rate your pain today?
About a 0.
0? Okay, great. Alright, so now we'll be doing some cerebellar function tests. So what we're going to do first is have you uncross your legs, and you're going to take your right heel and touch it to the top of your left shin with your eyes closed, and run it all the way down. And you're going to do the same thing with the other leg. Alright, great. And now we're going to do the Romberg's test, just a test for balance. So you're going to stand up, have your arms straight out, and close your eyes. Alright, so I'm just going to test your skin. So if you can give me your hand, and I'm just going to check for tenting of the skin to make sure you're hydrated. Good, your skin's very elastic and everything looks good. Take note of her tattoo. Everything looks normal. I'm just going to check. She's not clammy, everything feels normal. The skin is not dry, not too moist or oily. Overall, there's no obvious moles or anything that needs to be checked out, so the skin is great. So now I'm just going to inspect your head and your lymph nodes and your sinuses. So if you would just like tilt your head forward for me, I'm just going to inspect for any lesions or anything on the scalp. That looks good. Now I'm just going to palpate your frontal and maxillary sinuses. So tell me if you feel any pain with this. No?
Nope.
Alright, any pain with this?
Nope.
Alright, and now I'm just going to palpate all your lymph nodes in this area. So we're going to start here. And if you ever feel anything sensitive, just let me know, okay?
Okay.
Alright, feels good. And then if you could just open your jaw for me. Alright, and close. Alright, that's good. So now I'm just going to check your breath sounds. So, I'll check your heart sounds first, actually. So we'll do we'll start right here, the aorta, and then pulmonic, and then Erb's point, and then right here, right underneath there, and there. Alright, sounds good. And now I'm going to do breath sounds. So I'm just going to start with your throat. So take a deep breath in for me. Good. And again. Okay, and take a deep breath in for me. Again, take a deep breath in. And again. And again. And one more. And one more. Alright, and now I'm just going to have you turn so you're facing this way. And listen to the breath sounds. And you can move to the foot of the bed for me. And I'm going to listen to breath sounds on your back. So if you could just take a deep breath. Good. Again. Good. Again. Good. Again. Good. Again. Good. Again. Good. One more. Good. And one more. Good. And now if you could just face me one more time. I'm going to do your pulses. So I'm going to check for your temporal pulse. Good. It's +2 on both sides. Now you're carotid. We're only going to do one so you don't pass out. Good. Now we'll do the other. Good. They're both +2. Now we're going to do your brachial. So if you could just turn your palms up. Good. And your radial. Alright, great. They're all +2. And I'm just going to do your PMI really quick. So if you could just sit up straight for me. I'm just going to feel right underneath there for your PMI. Alright, and that's good. Alright, so now I'm just going to have you lay flat on the bed. And if you could just lift up your shirt for me. Thank you. So I'm just going to inspect the abdomen, make sure everything is nice and flat. There's no weird contour, nothing dipping in, no abnormal swelling, nothing like that. And now I'm just going to listen to your 4 quadrants to make sure you have normal bowel sounds. Alright, good. And now I'm just going to use the bell of the stethoscope to try to listen for any bruits in the abdominal aorta. Alright, everything sounds normal. And now I'm just going to percuss so I can see if you have any enlargement in your liver or spleen. So I'm going to start with the liver, which is in your right upper quadrant. Alright, that's normal. And I'm going to do your spleen now. Alright, and that is normal. So now I'm going to do light and deep palpations. So I'm going to start in your right lower quadrant. Make my way up. Everything feels normal. I can't palpate the liver or the spleen. Good. Now I'm just going to do deep palpation. So if you feel any pain, let me know. Alright, and now I'm just going to see if I can palpate the abdominal aorta, which I can, which is normal. And now I'm just going to see if I can palpate the kidneys. No. No, which is also normal. You don't want to be able to palpate the kidneys. Right, so now I'm just going to test your range of motion in your arms. So if you could raise your arms all the way above your head for me. Alright, great. And now if you could put those down, just look to your left, your right, and up and down. Alright, great. And now I'm just going to have you push against my hand. Alright, great. On the other side. Alright, awesome. And now just shrug your shoulders for me. Like shrug. There we go. And you can let that go. Alright, and we're going to do a grip test. So you're going to grab my fingers, and you're going to pull towards you. Good. Now push. Good. And now I'm just going to test your capillary refill while I'm here. So good. Less than 1 second for all of them. Just give me this hand. Great. So now I'm just gonna have to have you lay down. So I'm gonna check all your pulses. So your femoral, your popliteal, your posterior tibial, and you're gonna have to take off your shoes really quickly so I can just do your dorsalis pulse. Very great. So your femoral pulses. All right, good. Good. Great. Okay, so they're all +2, so they're all normal. I'm just gonna have to check the capillary refill on your toes. If you just take your socks off for me. Alright. Great. All less than 1 second, so that's normal. Great, so I'm just gonna have to have you sit up again. Actually, sorry, lay down one more time. We're gonna do your leg range of motion. So you're just gonna lift your right leg up, and then bend it, bring it all the way up to your chest, straighten it out, and then you can put it back down. And repeat the same thing with your other leg. Good, and now if you could just point your toes all the way, and now bring them all the way up towards your face. Alright, that's great. Now you can sit up. So here I would check her ears, but we don't have an otoscope, but if we did, I would lift the pin up and back, and then I would inspect. But we will, and I would make sure that there was the pearly gray tympanic membrane, of course. And so now we're going to do the test for tactile fremitus. So if you could just face the foot of the bed and just repeat 99. Just say 99.
99.
Good. And again?
99.
All right, great. And we're also going to do the whisper test. So if you could just move to the foot of the bed for me. And I'm going to say 3 words. I'm going to whisper them from behind you, and you're going to repeat them after me. So if you could just face towards there.
Baseball, room, apple.
All right, now if you could just face the other way.
Hat, laptop, carpet.
All right, that was great. So now I'm just going to check your throat. So if you could just open up and stick your tongue out and say ah for me. I'm just going to use a light. Good. Tonsils are normal. Everything is normal. I'm just going to palpate your tonsils really quickly. Make sure nothing is enlarged. Good. And then normally I would check for the gag reflex, but we don't have the tongue depressor, so I won't be doing that to my patient today. But yeah, so that's how you would inspect the throat. Make sure there are no white patches, nothing too swollen to the point that could obstruct her airway, or any serious inflammation or bleeding should not be occurring right now. So, alright, so now I'm just going to check your eyes. So if you could just take your glasses off for me and just look up and do a full circle. Alright, good. So I'm just going to have you follow this pen, okay?
Okay.
And don't move your head, just follow with your eyes. Alright, good. Now I'm just going to check for reactiveness to light. So I'm just going to... Alright, good. And now I'm just going to have you look at something behind me. Alright, and now focus on this pen as I bring it closer. Alright, good. Alright, so now I'm just going to check for jugular vein distension. So if you could go like this for me. Alright, great. And now the other side. Alright, awesome. So now I'm just going to check your nose. So what I'm going to do is have you close your eyes and have you smell something and see if you can identify what it is, because it's a common smell.
Puro.
Good. Alright, so now I'm just going to have you cover your one nostril and breathe in and out. Good. And now cover your other nostril and breathe in and out. Alright, and now if you could just look up. I'm just going to check your nostril, your nares. Alright, that was great. Yeah, so that's all for my head to toe assessment. Big thanks to my patient Morgan.